But yesterday was Mother's Day, so we celebrated mother care with Ayurveda. And today we have unique expert, Dr. Kuldeep Kumar Pandey ji from BHU, from Department of Sangya Harana. It is absolutely unique line for Ayurveda, and he is heading the department. I would like to welcome Dr. Vishnu Prasad Sharma ji, ex-principal, Guwahati Ayurvedic College and President Vishwa Ayurved Parsad. I would like to welcome Dr. V.K. Agnihotri ji, ex-HOD, Uttarakhand Ayurved University, Haridwar. And I welcome the audience, Momita Sharma, Sayantika, Subdeep ji, all. So without wasting much time, I would like to invite Vishnu Prasad Sharma ji to welcome the expert as well as his classmate, Sri Dr. Kuldeep Kumar Pandey ji. Welcome, sir. Dr. Vishnu Prasad Sharma ji.
Okay, good evening. Namaskar to everybody. Respected Pawan Kumar Sharma ji, respected V.K. Agnihotri ji, eminent speaker, distinguished guests, ladies and gentlemen. We have a very important webinar, Thalassemia, Concept and Cure. It is the most important subject. Yes, today we have very eminent speaker, including my friend, Dr. Kuldeep Pandey. So I invite all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar. And I declare that evening webinar is open. Now we can discuss. Namaskar, namaskar to all. Can you hear my voice, Pandey? Hello?
Yes, sir.
Pandey, can you hear my voice?
Yes, sir. Loud and clear.
Okay then, thank you. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to today's evening webinar.
Thank you.
Kuldeep is my friend. Yes.
I am really happy to welcome your classmate, Dr. Kuldeep Kumar Pandey ji. As we all are aware,
yes, same.
That due to hackers and Zoom bombing, we have restricted direct entry, but our event will be live on YouTube. YouTube link will be sent just after starting the event. So kindly circulate it to the maximum persons to involve them. Thank you. Thank you very much. I would like to request Kuldeep Kumar Pandey ji for initial words. As his presentation is with me, I can play the presentation after his initial blessings to the platform and today's event.
Okay. Thanks for nice words. My dear friend, Dr. Vishnuji, Dr. Pawan Sharma ji, and Dr. Agnihotri ji. It's my pleasure to be with you on that very burning issue of thalassemia, which has been many a times it has been incurable, or it is very difficult to cure. But if you go through the text of Ayurveda, we find there as such no any word has been coined in the text of Ayurveda as a thalassemia. But being a disease, blood-borne, and that to be inherited, so definitely some sort of concepts are available, and we have to interpret it according to their clinical signs and symptoms and pictures what the patient is facing. On that very basis, I have tried my level best to incorporate the integration of the concepts of Ayurveda regarding the thalassemia and how we can cure, rather we can care the patients according to the principles of Ayurveda. With these words, I would like to express my sincere thanks to the organizers, and especially I'm very happy to see my batchmate, Dr. Sharma and Dr. Agnihotri ji. Apart from that, the nice words you have expressed in my honor, that is my honor, and I have been honored by you. Thank you very much.
Thank you, sir. Thank you for your kind words.
Sharmaji and the most reverend personality of the occasion, Dr. Madanji from Cambridge. My other speaker friends, Dr. Anukul and Dr. Saurabh. My dear friends, today we are going to talk about the thalassemia and the concept of Ayurveda. In Ayurveda, if we go through the text, there is no any word mentioned as such in the term of thalassemia. But the clinical pictures resembling to thalassemia are mentioned here and there, and that may take into consideration. Before going into the discussion of this very topic, I pay my homage and regards to this great saint of the era, Bharat Ratna Mahamana Pandit Madan Mohan Malviya, who had a long back, century back, had a vision to educate the society of the country in an integration approach. And that's why this seat of learning, this Banaras Hindu University, was established with a concept that amalgamation of ancient and modern wisdom is the need of the nation, or you can say is the need of the whole universe, to pacify the pain of the sufferings. This very gate where Mahamana's picture is there had a story behind this one. When he was in the last days of his life, Mahatma Gandhi came to him and asked, now relax, Panditji. Then Panditji replied that I will not be relaxed until I will not get a way or a gate to enter the patient's body and to find the cause of suffering. So this very gate, when I used to enter to the campus, reminds me always, find a gate, find a way, find the solution to pacify the pains of the suffering. And that is possible only with the Mahamana's vision, amalgamation of ancient wisdom with the modern science. Friends, this thalassemia, we all know that it is an inherited blood disorders where the body of a patient or person is unable to make the enough protein that is called hemoglobin, and which is an important part of the red blood cells. Our blood has many solid and liquid components. Apart from that, red blood cells are responsible with their lifespan of 120 days, carries the essential vital factor, that is the nutrition, in terms of oxidation and the oxygen. So if it is sick, definitely there is a problem of oxygen carrying capacity in a person. The threats for thalassemia are more common in people in Mediterranean countries like Greece, Turkey, and people from the Asia and Africa and Middle East. They are more sufferers of this one. Then now what happens when there is a thalassemia in RBC? RBC structure is the biconcave and elliptical. That's why it can pass through a minor vessels of the body and supplies to the end cell with the oxygen and nutrition, which is essential for the survival of a living cell. When the structure of this RBC is distorted or is altered in shape and size, then it can't pass, and that's why the oxygen carrying capacity along with the nutrients transportation is depressed, and the patient may suffer with the disease so-called thalassemia. In a patient of thalassemia, what happens? Why the life becomes taboo? Because there is anemia. And when there is anemia, definitely there is a dyspnea, fatigue, and the growth retardation.
All these are concerned with each other. Anemia causes growth retardation, fatigue, and dyspnea, and dyspnea causes fatigue, growth retardation. So interlinked characters are the clinical pictures of a suffering or the basic cause of the anemia. When we go through the global problem of the thalassemia, we find that and studies showed that the 1.5% of the global population, that is 80 to 90 million people, they are the carriers of the beta thalassemia. And out of that, 60,000 are the symptomatic individual born annually. This great majority is mostly found in the developing world of the universe. 4.4 out of every 10,000 live births. I'm saying here the live births means the baby is born, and out of 10,000, 4.4 are the sufferers. And the condition is caused in both the genders, either it may be male or the female, because the disease is autosomal. So there is no any gender demarcation that male will suffer more or the female will be more. So what the picture of thalassemia in our country is, that is the India has the largest number of the children with the thalassemia measure. And that's why when we go through the analysis of the population wise this incidence, we find that the thalassemia measure is found majority of the patients in our own countries. About 1 to 1.5 lakhs and almost 42 million carriers of beta thalassemia triads are found there, and 10,000 to 15,000 babies with thalassemia measure are born every year. So the picture says that this much population of the newly born babies are suffering with the thalassemia problems. When we go to find out what types of the thalassemia are there, so three main types are there: beta thalassemia, alpha thalassemia, and thalassemia minor. And they are having four subtypes: major and intermediate with the beta thalassemia. Alpha thalassemia has the hemoglobin H and hydrops fetalis. All these types and subtypes are varying in symptoms and severity. When it comes from the mother one, father one, then the mild. When it becomes double of the strength in the DNA content, then we can say that there is a problem of the severity in the patients of the newly born. Then question arises, if a patient is diagnosed as the thalassemia, then what the survival rate of those patients is there? So data shows that since birth to 10 years, 99% is survival, and after reaching up to 20 years, 88%, and survival until 45 years, it is 74%, and up to 50 years, it is 68%, and until 55 years is the 51%. So this picture says that what the survival is there. What are the symptoms? हम कैसे कहेंगे कि this patient is suffering with the thalassemia, and what are the diagnoses? So some of the most common one is the bone deformity, especially in the face, dark urine color because of the destruction of the RBCs, and delayed growth and development because of the improper nutrition and the metabolism, and excessive tiredness without any physical work. There is a feature of the tiredness and fatigueness because of the improper glucose formation and glucose transportation and energy transportation and the oxidation for the metabolism. Yellow or the pale skin is because of the bilirubin content, and the anemia is there. So in current scenario, what are the treatment modalities? First one is the blood transfusion. Because there is improper formation of the blood, and the patient for the survival requires the optimum level of the hemoglobin concentration, and that time the blood transfusion is needed between 2 to 3 weeks. Ultimately, the bone marrow transplant is the foremost treatment, but it is not always possible because of the cost effective and the donor effectiveness. Sometimes the medications related to the treatment and the supplements are available and they relieve the patient up to some extent. Now, trends has come into the medical armamentarium, that is the surgical removal of the spleen and gallbladder, because the spleen is enlarged in those conditions, and the sick spleen is the graveyard of the dead RBCs. So this was a brief introduction about the thalassemia in modern medical. I'm not going into details of those because other speakers will, the topic allotted to them, I have come to know that they will speak over there. So I will concentrate what are the thalassemia care in the Ayurveda. And Ayurveda stands where only there is a care is more important than the cure, because the complete cure is not possible with those. So concept of Ayurveda. What is the concept of Ayurveda? As I earlier said, that there is no clear nomenclature, or they have not coined the terminology of the thalassemia, and so far that it is not very much sure that what we can say. But any metabolic or any alteration or any type of the deformity in the blood formulation and the blood formation and their components may be coined as the on the basis of the pictures related to the thalassemia. But before that, when we say that this is an inherited disease, so in Ayurvedic text it has been mentioned that the Shukra Shonit Sanyogat Yo Bhavet Dos Utkata Prakriti Jayate Tena, meaning that the three types of prakritis, they prakritis, are according to the characteristic features of the ovum and the sperm. When we talk about the prakriti, that does not denote only the morphological structure or the characteristic features of a person, but also it includes the health content, meaning that the components of the health and the disease, those which are already carried from the parents, are there. So any abnormality, if it is there in the ovum or sperm, that may definitely will be carried in the offsprings. So what happens when the terminology of the Raktalpata or Raktajanna Vikaras, this can be under the heading of this, and this thalassemia comes under this heading. So what happens when we find the process of the ahar pak or ahar metabolism, then we can say that if it is properly metabolized, means not in the GI system, that when that is ingestion, digestion, assimilation, and then excretion. But here, according to Kedari Kulya Nyaya, Uttarottar Dhatu, successive dhatus development is based on this one. So, when there is improper formation of the blood cell, is definitely there is a problem in the nature, procedures, process, and the digestion of the particular food, and how it has been assimilated, and then what is the metabolism, ultimate metabolism. According to the principles of Ayurveda, there is a pak of ras dhatus, and when it gets further matured, it divides into prasad bhag and keta bhag. From the prasad bhag, there is a one form which is related for that particular rasa and rasadhatu, and the other part is for the development and the precursor of the other next dhatus, that is the rakta. So for that, if it is not properly digested, means there is no proper metabolized, then definitely there is a problem of apakko dhatu nirmana, and that is there. And second one is the improper code of conduct. If there is no proper code of conduct, means the digestion of food is always related with the mood and from the GI system. When those two are interlinked and they vice versa influence to each other, then the digestion is proper. And if it is not there, definitely some of the problems may develop there. While considering the genetic characters from the inherited disease, there is a in Charak Samhita, Vimanasthan, it has been said that there are garbhodpadak bhavas. Matrajas chayam garva, pitrajas chayam garva, rasasjas. So many factors are there, and when predominantly matrija bhava, which are responsible for the formation of the tvaka, rakta, mansa, meda, harta, kloma, yakrita, pliha, vikka, vasti, nabi, amashaya, antra, pakwasha, and so on. The soft body organs are from the matrija bhavas. So if we can consider the other bhavas because of the non-availability of those resources, and there are no specific parameters. So matrija bhava is more important. So while we consider this matrija bhava, and that can be cured easily because the garva is inside the matri, and when we cure the matra and we care the mata, then only we can say that these bhavas can be corrected very easily. So the causes of this anemia or raktalpada or the disease itself is thalassemia. There is a dusti janya vikaras. So what is the time where it develops? That is the ingestion period, and that is the childhood. Then what are the factors? It is from the mother's own formation system of the blood. And what are the factors which can influence the formation of blood in a mother? That is more important there. What are the seeds? That is the heart, liver, spleen, and the blood vessels. Then coming to the seat of the disease, the whole body is affected because the blood flows to the end cells of the body, so whole body is affected. Dosas according to Ayurveda are the Pachak, Sadak, and Kledakaf, and the Samanvay. So these three dosas are very much responsible for the proper digestion of that food and the formation of the rasa and further formation of the uttar dhatus, that is the rakta, masa, ved, and so on. So doshas are very much important here. That is the rasa, rakta, masa, majja, and tvak. These are the affected areas where this can be. And what are the channels are there? That is the rasvasrutas and raktavasrutas. The characteristic features, what we can find in a patient immediately instantly, that is the anemia and the jaundice like pictures. The system which are involved or may be affected there are the digestive system, circulatory system, hepatobiliary system, and hepatorenal system, and the splenic system. What is the nature of the disease? It is very ashukari, prompt. There is no time to cure the baby or the patient if it is there in a major time. And that's why it has been said under the category of the incurable or it is difficult to treat when we talk about the prognosis. So according to principles of Ayurveda, these are the certain parameters where we can analyze and we can treat according to their onset of the disease and rog, adhisthana, those dusyas, sotas, and the lakshanas. These are there. Why it is important to treat a baby and why it is a vital. In Sushruta Samhita, it has been mentioned that dehasya rudiram mulam rudirena iva dharite tasmat yatnen sanraksha raktam jiva iti. Means, what are the functions of a root in a plant are those in a person or in a living body. Meaning that to make the strengthen, to make the stability of a patient or a person. And it has the physiological strengthening capacity by which a person is alive. And that's why each and every component of the blood is to be maintained and is to be restored. And that's why it is known as the Jeev. And when one Jeev is transplanted into the other Jeev, that's why the transplant of the Jeev to other Jeev is known as the transfusion. That's why the blood is said the blood transfusion, not the infusion. And this transplant is meant to make a patient alive because it is more precious for a life. Then coming to the where it flows, it has a channels, that is the Rasvasrotas, Ratvasrotas, Annavasrotas and Sukh-Ujavasrotas. These are the srotas of the pranas, and pranas are the synonyms of the Rakta, and Rakta is responsible for the oxygen carry and the nutrition. When there is no carrier of the oxygen and there is no any nutrition, definitely the life is totally impossible. Prana yatra pratishthata avalambate means that is the hridaya, and the phufus and coast are the other two parts, those which are responsible to nurture the heart and to nurture the body cells and vice versa. That's why when the pranapan vasajyo means these two are responsible, means when there is a movement of this energy flow with the oxygen and nutrition, then there is a life. And this life flows through the srotas, and srotas are responsible. But when these channels, srotas, are empty with the energy content, that is the proper form and proper characteristic features of the RBC, then that is the life-threatening. And that is why the blood is more important, and here is the basic stan, basic statement. How it is responsible? Because in Sharanga Samhita it has mentioned Navista Pranapavana Sprastva Hitakumlantaram Kanthat Bahirnarayat Patum Visnupadamritam Pitva Ambar Piyusha Punarayati Vegata. Means why it is essential? Because when there is a transportation of the Ambara Piyusha, means the oxygen of the atmosphere, and that is being carried by the RBCs. And when there is a Raktalpata due to either regions, means the oxygen carrying capacity to the RBC is decreased. Even though there is a pranapan kriya, there is a respiratory movement or respiratory functions, but it is not up to mark to fulfill the need and the demand of an organ which is responsible to pump out the blood, or which is responsible to ventilate and the blood gas partition coefficient inside the lungs, and to maintain the turgidity of the cell structures or the cell organelles with the energy and the oxygen, then definitely there is a lack of oxygen and the patient may die because of the oxygen and the energy, and this is only because of the anatomical change in the RBCs. So what happens when there is a rasakshay, means improper metabolism of the food with the Kedari Kulya Nyaya, improper assimilation is there, so definitely there is a hritapida, anginal pain must be there is a kump, there are tremors, shunyata, when there is a lack of body is senseless, then a very light, and there is a continuous feeling of the trishna because it affects the klom, and klom is the matrasabhava. And in the case of Raktakshaya, there is a hypothesis behind this one. When we talk about the cells of a body, it may be a somatic cell or it may be stem cell. When they divide into two, they give rise to identicals. But when stem cell divides, bone marrow stem cell divides into two, one is for the own nurturing and the other is for the development of the next stages. But in case of thalassemia, when it divides into two, into other form of its original characteristic features, it gives rise to the characters of the thalassemia. And when both of the cells are divided into either nature and they grow and grow, that will cause the destruction of the natural RBCs and causing the. And that was the concept of our Ayurvedic physicians long back, and how it has been correlated with the Raktakshaya disease. There is a clinical picture of the Musha, Tvacha Parushya, Shaithalya, Swaskas, and the Panduta. These are characteristic features resembling to the pictures of the thalassemia. So, the Dhatu Portion phenomena as described in the text of Ayurveda is most of the time it resembles with the cellular metabolism and its formation of the precursor cells of the RBCs. Coming to the point how we are going to make a plan for the treatment of the thalassemia from Ayurvedic views. So we have to select those drugs which improves the oxygenation, release the anemia or Rakta. They may be Rakta Prasadak. In Charak Samhita it has been mentioned as the Rakta Prasadak. Prasadak means, Prasad means Prasannata. And Prasannata means the which is suitable to formation of the proper blood and to maintain its integrity up to a particular life span with the qualities. And when it is the other characteristic feature of the herbal drugs must be from the Rasayana categories and they must improve the immune system or the Ojovardhak. Enhancement of the Raktujanya Vyadhis, to pacify the Raktujanya Vyadhis, Raktavayo, improvement that the component, we are talking about the RBC only. No, not at all. Because only RBC is not responsible to maintain its own contour. Other contents are the other organelles of the blood, it may be liquid part, it may be solid part, that are equally important to maintain the integrity of a particular cell. So that is a society, and in that particular society, many types of the cells and fluids are there, electrolytes are there, they all are important. And that's why it is to be taken into consideration for the improvement of the metabolism, improvement of the dhatu pak, and that must be free from the drowsiness and the fatigue. Because many times when there is a enrichment of the blood components and bloods and other, but the fatigue is there. So other causes may be from the other system of the body, and that must be taken into consideration. And over and all, there must be dhatu samyata. Dhatu samyata means proper paripak of each and every dhatus must be there. From rasa to ojas, that must be in proper form, and only because of the samyata, balance, homeostasis of the dhatus. And that's why the definition of the health is then samadosa samagnischa. Very next, after this dosas, there is a Agni concept is there. This is not for writing a poetry in that very manner. Because when the dosas are the three body humors are the basic characteristic features are the building materials of a body, then after that there are the concept of the dhatus. Samadosa, samagnischa, samadhatu. If Agni is maintained, means metabolism is properly maintained, then samadhatu must be there. And ultimately malakriya will be there. So this is very much important to maintain the integral part of this body contour, that is the three dosas, and then metabolism and the dhatus are there. So coming to the part of the treatment, there is a preventive part, means prophylactic, how we can prevent. Being a inherited disease, there is a concept of Atulya Gotriya Vaiva. Means the person, if he is living with any particular disease which can be inherited or transmitted to the coming generation, so that can be prevented at this very junction. And for that, there must be Dasvid Pariksha Bhav, Sattva Satma, Ahara, Bala, Vyayam. So many factors are there that may be considered, taken into consideration. But in modern medicine, what there is a electrophoretic method, and before the progeny, one should come to the many types of the infestations, and that is essential part of incoming generation. But in Ayurveda, it has been clearly mentioned that for Atulagotriya, means different family, different gotras, some diseases are the familial, some are in generations, and others that can be prevented at this very moment. And that one, the third one is the code of good conduct. If we follow the Sadavritta Vyavahar, then definitely the mind and body are not two separate entities. They affect on each other. So when we follow the code of good conduct, means many characteristic features automatically they are being changed. And last one is the Garbhani Paricharya, because the baby inside the mother's womb, and if a proper care according to the gradual development of the fetus is taken, then definitely a large number of the complications and can be reduced or minimized, and the survival rate of a person can be enhanced with the quality life, and there will be a decrease in the frequent transfusion of the blood for the survival of the patient. Coming to the curative treatment, what we are doing here is the Yakriti Uttejak, means metabolism of drugs which are responsible to stimulate, the protect, and to maintain the metabolism function of the liver. And sometimes there may be inflammatory problems, and that Sothar Drabyas may be used. Rakta Prasadak Drabyas may be used. Rakta Vardhak are there, many herbal preparations, herbo-mineral preparations, and are there. Diuretics have their own role because Vrik is affected, and Vivandhahar means the constipation, because these are the maternal parts, GI system and the intestine, Amasa, Pakwasa, and Antras, they are the developed from the maternal part. Definitely there might be some relation between the this thalassemia and the GI system, especially of these organs related to. And ultimately there is the foremost center is the Hridaya, because when the heart is there, and that requires the pure form of the oxygen, pure form of the blood, pure form of the snart energy, and that is to be taken into consideration while we are going to prepare a formulation of a patient. So there are many more drugs mentioned, and some of them I have quoted here. The Punarnama, you all know that the Amrita, Tulsi, Neem, Adusa has a very good role there. The Bhumi Amalki, it is hepatoprotective and appetizer and detoxification. And Ashwagandha is there. Rohitak and Bhallatak, they have their specific roles. And the Haridra, no doubt, is more effective in that condition. And the Gokshuru and the Gritkumari and the Rakta Cholai. I used to prescribe this formulation to my patients, that Rakta Cholai, Amaranthus family. When we break the stem of this Rakta Cholai, we find there is a cheesy material inside the stem, and that can be correlated with the bone marrow of the patient or the person. And when we formulate these drugs according to need, according to severity, according to symptoms involved, and then we ask the patient to take these medications with the juice of this Rakta Cholai, and that is more effective in my own experience. And some sort of this rest preparation, Punarva, Mantur, and Swarnamakshi, they have their own role to regenerate the stem cells of the bone marrow and to procure the good quality of the RBCs. And this Swarnamakshi had very good result apart from this Punarva, Mantur, because on one hand it enhances the metabolic characteristic features of this liver, detoxifies the mal products, and improves the quality of the RBCs. So friends, though this is very difficult to treat a patient of thalassemia because of many more characteristic features and the poor sufferings of the low economical gentry, every time it is not possible to have frequent investigations and to use this blood transfusion after 2 or 3 weeks in a patient, and non-availability of the blood and the stem cells is there. But if we consider all those factors in our mind, then we can say that this thalassemia can be prevented up to some extent. So I am thankful to the organizers, especially Dr. Pawan Sharma ji, for giving this opportunity to share my experiences and views on this very auspicious occasion when we all are taking pains to pacify the pain of thalassemia-induced patient and the families of the nation. Today we have come together, and this is just the beginning, and when we keep together, definitely we will progress, and when we will start work together, definitely we will succeed. Thank you all. A very good evening.
Excellent, sir. Excellent. You have covered everything, almost everything. Great. Very nice, sir. We are really inspired. पांडे जी, बहुत ही अच्छा आपने प्रेजेंटेशन दिया और बहुत ही अच्छी एक इंस्पायरिंग स्पीच थी. थैंक यू वेरी मच. अग्निहोत्री सर कुछ बोलेंगे? Respected Agnihotri sir. So now I would like to welcome Dr. Anukul Chandra. Dr. Anukul Chandra is Professor, Department of Rog Nidan and Vikrati Vigyan, Institute of Medical Sciences, Banaras Hindu University, Varanasi. Welcome, Dr. Anukul ji.
Thank you, sir.
Welcome. Now stage is yours.
So unfortunately, video is not opening. So I will just, can I share the screen?
Yes, definitely. Yes, your screen is visible.
So visible.
Your screen is visible. Kindly start your PowerPoint presentation.
Sorry. Is it visible?
Yes, clear, doctor, clear. Welcome. Welcome.
Just a minute. Just excuse me for 1 minute.
Sure.
शर्मा जी नमस्कार.
Please take your.
शर्मा जी आप कुछ कह रहे थे?
जी. कुलदीप सर के प्रेजेंटेशन के बारे में.
हाँ. अरे हम इतने ध्यान अवस्थित हो गए कि हमारा म्यूट वो दोनों म्यूट हो गए थे. तो मैं it's our great pleasure that now BHU persons are actively started participating in our conference, in our webinar, right from Mamta Tiwari to our Pandey ji. Again, Karsar is also with us today. So I was remembering way back, say 80s, and I found that one of my close friend, Dr. D.N. Pandey ji, was there in physiology. He was my immediate junior and residing next to my room, that is 20 room in Nagarjun Hostel. So I was
Dr. D.N. Pandey is still here, and he will work up to June, this June 30th.
I know before my this time visit on 5th of our May, I was locating you or seeing you from a little far, but today I am fortunate enough to hear you, and
My pleasure, sir. It's my pleasure.
Okay, sir.
pleasure is all
I'm
mine.
back, sir.
The fact is that you very naturally, being a person from BHU, touched all the areas pertaining to thalassemia as such of today's subject, and you touched especially the three important symptoms which are interrelated. That is, one is anemia, the second one is dyspnea, and then third is the retardation, and these are interconnected. This you pointed out very importantly, and this is a fact. On the other hand, you touched the whole of the concept, types, and symptomatology of thalassemia from modern side. At the same time, you peeped into the matter, all the possibilities which can be said to be or near to the word thalassemia. So, what importance you put forward right from Shukra Shoni Sanyoga Yodosh Bhavit Utkataha Pekta Jate Tena, right from there to Kidari Kalyanyay and all that. So the concept is this, that we should be careful for the Raktagni and Rasagni. Means Dhatvagni itself is of great value. Then only we will be having a better quality of our Rakt Dhatu. So this was the emphasis on a point. As far as the morphological changes in RBCs are concerned, that is very much there. You touched all that point. What may be the treatment part, as you told, as our Charak Sanghita says that mansam manskaram param. So if there is a emaciation of the muscles or the mans juice can be advocated apart from the medicines, so goes the case in this case also. All the hematinics can be of great value. So you touched all that area, and we will make other important points at the time of closing. So wonderful. It's my pleasure to see you people, and I am feeling proud of it. Thank you, sir. Thank you.
Thanks for your comments, sir. Very nice to hear you.
Shall I start, sir?
Yes,
Sure.
yes, stage is
Yes.
yours.
So, sir, thank you very much for inviting me to talk about this.
Welcome, Dr. Kar.
Dr. Pawan Sharma-ji, Dr. Vishnu Sharma-ji, Dr. K.K. Pandey-ji, Dr. Saurabh-ji, Dr. Abhinayatri-ji, I am very much thankful that I feel honored to speak before you on this day, on the occasion of World Thalassemia Day. So I will already, Dr. K.K. Pandey-ji had given the talk on the thalassemia and Ayurvedic part of the cure. So my talk will be just, I will briefly touch the modern aspect, and I will talk about the Sampratti of this thalassemia in Ayurveda. And in the third part, I will just touch about some researches, what has been done till date. I will put forward before the. So you know that thalassemia is an inherited disease of faulty synthesis of hemoglobin, and the name is derived from the Greek word thalassa, that means sea, because the condition was first described in populations living near the Mediterranean Sea, and emia meaning blood. And this condition occurs in the Middle East, Indian subcontinent, and Southeast Asia. And in India, it is seen throughout the country, and approximately 35 million have beta thalassemia major. And its incidence is particularly high in some races, such as in Punjabis, who migrated from Pakistan after partition, then Bengalis, Gujaratis, and Parsis. It is predominantly seen in these races. So regarding the definition of thalassemia, this is a diverse group of hereditary disorders in which there is reduced synthesis of one or more of the globin polypeptide chains. According to World Health Organization, thalassemia is a genetically passed down blood disorder disease in which body makes an abnormal form of hemoglobin due to defects in the globin chain. So regarding the types and the classification of, you know that normally an individual inherits two beta globin genes located on 2 chromosome 11 and 2 alpha globin genes, one each on 2 chromosome 16. And it is inherited from each parent, so that forms the normal adult hemoglobin, which is called as HbA and having alpha 2 and beta 2 chains. So depending upon whether the genetic defect or deletion lies in transmission of alpha or beta globin chain genes, thalassemia can be classified into broadly 2 groups, that is alpha thalassemia and beta thalassemia. Alpha thalassemia occurs when some or all of the 4 genes that make hemoglobin, the alpha globin genes, are missing or damaged. Beta thalassemia occurs when one or all of the 2 genes that make hemoglobin, the beta globin genes, are missing or damaged. So each of the 2 main types of thalassemia may occur as heterozygous alpha and beta thalassemia, that is called thalassemia minor or thalassemia trait, and patients in this group are generally asymptomatic. And a homozygous alpha and beta thalassemia major, and the patient belong to this group are having severe symptoms. Then coming to types, the already Dr. K.K. Pandey has told, I will just briefly describe that. Alpha thalassemia types, which is alpha thalassemia silent carrier, alpha thalassemia carrier, hemoglobin H disease, and alpha thalassemia major. Similarly, beta thalassemia types are 3 types, that is beta thalassemia trait or beta thalassemia minor, beta thalassemia intermediate, or beta thalassemia major. So in alpha, 4 types of alpha thalassemia, that is alpha thalassemia silent carrier, that is it is on the basis of the missing of the genes. One gene is missing or damaged and other 3 are normal. So all the blood parameters are usually normal. The red blood cells may be smaller than normal. And being a silent carrier means individual do not have signs or symptoms of the disease, but can pass the damaged gene on to their offspring, and that can be confirmed by the DNA test. Then alpha thalassemia actual carrier, that is 2 genes are missing. This results in only mild anemia and the patient can lead a normal life. Hemoglobin H disease, that is in case of 3 genes are missing, this leaves just 1 working gene, and the patient is having moderate to severe anemia. The symptoms can worsen with fever and other symptoms. And if the patient is get exposed to certain medicines, chemicals, or infectious agents, blood transfusions are often needed, if not regularly needed. And the individual has a greater risk of having a child with alpha thalassemia major. Then coming to alpha thalassemia major, all 4 genes are missing, and this causes severe anemia. And in most cases, the baby may be die within the uterus or after birth, few days or weeks, the patient may die. Now coming to the 3 main types of beta thalassemia, I can just highlight something here. That beta thalassemia are caused by decreased rate of that beta chain synthesis, resulting in the reduced formation of adult hemoglobin in red cells. If you go to the molecular pathogenesis of this beta thalassemia, that is more complex in contrast to the alpha thalassemia. In contrast to alpha thalassemia, gene deletion rarely causes beta thalassemia. Rather, instead, most of the beta thalassemia arise from different types of mutation of beta globin genes, which results from single base changes. So there are 2 types of symbol they are using, that beta 0 and beta plus. Beta 0 means that indicates the complete absence of beta globin chain synthesis, and beta plus denotes the partial synthesis of beta globin chains. So more than 100 such mutations have been described, but the mechanism, some of the important ones are there is transcription defect or translation defect or mRNA splicing defect. So on the basis of this, there are 3 main types of beta thalassemia. There is only reduced synthesis of beta globin chains. That beta thalassemia carrier, trait, or minor. So these people are having mild anemia, but usually do not need any medical treatment. and usually don't have any severe symptoms. Now coming to beta thalassemia intermedia, people with beta thalassemia intermedia have a moderately severe anemia. Some will need blood transfusion and other medical treatment, and blood transfusion deliver healthy hemoglobin and RBCs to the body. And these patients are having extreme tiredness, pale skin, shortness of breath, fast tachycardia, fast heartbeat, irritability, slow growth, change in shape of the bones, because there is expansion of the bones due to the marked erythroid hyperplasia. So that lead to thalassemic facies and malocclusion of the jaw. So coming to beta thalassemia major, that is called also Mediterranean anemia or Cooley's anemia. And people with beta thalassemia major have life-threatening anemia, and they need regular blood transfusion, for which they are having the heavy iron overload in the body that lead to the deposition of iron in the vital organs like liver, heart, and everything. So that causes cardiac siderosis, and in the liver there is hemosiderosis. All these pancreas causing bronze diabetes. All the things can happen. But these children with beta thalassemia intermediate or major may not show any symptoms at birth, but usually develop anemia in the first 2 years of life. Family history, ancestry, the risk factors. Now coming to diagnostic part, simple. The first part, the primary hematology tests that whole CBC, complete blood cell count, and by examining the erythrocyte indices, and by the examination of the blood smear or brilliant crescent blue staining. So if there is low MCV less than 80 femtoliter or low MCS less than 27 picogram, so if it is ruled out the other causes of anemia, then you go for the GBP, the null blood picture. If it is microcytosis, hypochromia, and Tiger cells are found, or Hans bodies are found, either that may be found, that may not be found. And if the serum ferritin is less than 12 nanogram per ml, then that can be considered as iron deficiency anemia, and there will be 3 months treatment should be given by the adequate iron supplements. If there is no improvement, then you can go for the HB electrophoresis or HPLC. And if there is microcytosis, hypochromic, RBCs having target cells, and inclusion of bodies like Hans bodies, then if serum ferritin is more than 12 nanogram per ml, then we can go directly to there is suspicion of thalassemia. Then we'll go for the HB electrophoresis and HPLC. And these are the parameters for categorization of the thalassemia. I will not go into the detail and regarding the genetic testing that can be by the DNA analysis for alpha and beta globin mutation to detect the which type of mutation is which type of chain deficiency there. Now coming to management and cure, the blood transfusion is very much necessary to maintain the hemoglobin level, but it has a certain limitation because there will be iron overload in the body. So concurrently iron chelation therapy is required. Some drugs are also given like hydroxyurea, that is enhanced total hemoglobin level in the body. This is a cost-effective drug. And other things are that is very costly, that is hematopoietic stem cell transplantation, HSCT. It is a lifetime therapy that can produce normal hemoglobin, but the limitation is HLA-matched donor is required and immunosuppression is necessary. There are some limitations. And gene therapy, this is a living drug. There will be by which there will be normal differentiation of erythropoietic cells, but again limitation that can lead to tumor formation, viral toxicity, and germline transfer. Then gene editing is also there. It is a advanced therapy, but very costly. Everyone cannot afford this gene editing. So this is a lifetime therapy, and this recipient can produce healthy children. But this is the advantage that no immunosuppression is required. Now coming to Ayurvedic view of thalassemia. So you know that the disease similar to thalassemia is not described in Ayurveda. But on the basis of conceptual understanding through Ayurveda, thalassemia may be correlated with Bijadosajanya Adi Bala Prabhuta and Sahaja Vyadhi, and this nomenclature may be coined as Vijadushti-janya. You know that Adi Bala Prabhuta Vyadhi, that Sushrut has mentioned Kushtha Arsa Prabhutaya. Prabhutaya means they have given a clue that so many diseases can be included which can be newly detected, that can be included. Dalan in his commentary also added that Meha Chayadaya in Adibala Prabhuta Vyadhi. So likewise, since Sushrut has given Prabhuta award has been given, it means there is a chance of adding so many diseases which can be discovered newly. So it is a, you can know that you know that it is a Pitta Pradhan Tidoshaja disease, and due to Sahaja Karana, the process of formation of Rakta Dhatu is affected, which leads to Raktavas Ruta Dushti and result in Rakta Vikriti. So it can be on the principle of Anukta Vyadhi. The concept of Anukta Vyadhi is very popular in Ayurveda. Anukta is one of the time-tested principle of Ayurveda, which gives us the direction to understand the newly formed diseases. The diseases that is not mentioned in the text or newly identified are categorized under Anukta Vyadhi. The Acharyas had vision of forthcoming new disease, hence they explained the concept of understanding the new disease as Anukta Vyadhi. But before going to the describe the to understand the pathogenesis of thalassemia in as per principle of Ayurveda, we have to understand this few concepts. So for better understanding the concept of Bija, Bija Bhaga and Bija Bhaga should be clear because of the genetic nature of thalassemia. Charaka mentioned Aptopodesha method of examination. We can acquire knowledge as described by Apta, which used to understand a disease. They have mentioned Evam Nama, Evam Jani, Evam Uthanam, Evam Udarkam, like this, Evam Upadravam. All the things they have been described. There are 22 factors from Aptodesha we can have a knowledge. Concept of Atulya Gotra Vibhaga, non-consanguineous marriage. Already Dr. Pandey had highlighted this concept. That in Ayurvedic classic that the Tulya Gotra Vibhaga should not be allowed. The reason for it is maybe presumed that Tulya Gotra Vibhaga will increase the chances of genetic and hereditary disorder. Hence, Ayurveda propagates Tulya Gotra Vibhaga. Then coming to concept of Bijadushti Jani Vikara, that genetic basis of various diseases are known to ancient Acharya. They have vividly described this thing. They describe the possible causes of Bijadushti, that is that can be nearer term, can be point that defected mutation, and also indicated the possible consequences in the form of Tidosha Prokopa, that is vitiation of body humors, which results in Vikrita Avayava, that is defected organs, formation corresponding to biochemical abnormalities or functional abnormalities and structural defects related to Upatapta Bija or Bijabhaga, which either Bija or Bijabhaga, which person is Upatapta, accordingly the Avayava will be Vikrita. I have already told you that they describe genetic basis of various diseases like Arsa, Pramya, Kushtha, and so on. So all are asadhya in nature. It is also one aspect of the disease. So Acharya Charaka described Bijadushti Jani Vikaras, wherein he explained that specific Avayava should be Vikrita if dosas vitiate specific Bija or Bijabhaga. Now on the basis of this concept, we can have a Samprapti like this, that there is excessive intake of Pitta Vardhaka Ahara. There will be Pitta Pradhan Tidosha Dushti, where there will be Usna Guna Pitta increases along with Raga, that is called Pitta Usma. And this Pitta Usma in combination with Rasadhatu results in vitiation of Rakta Dhatu in parents. And these parents, if they have done the Mithyahara Vihara and Purvakrita Karma, if they have the genetic inheritance, then that results into the Upatapta of Sukra and Upatapta of Sonita, which can give rise to Upatapta Bija, that can be called as zygote, which is homozygous condition for the mutated globin genes. So Upatattva and Upatattva of Bijadushti, the mutation results in variability or changes at the level of phenotypes. So Upahata Bija, which is responsible for Rakta Dhatu Nirmana, result in Rakta Dhatu Agni Dushti, which lead to Vikrita and decreased Rakta Dhatu Nirmana. And that decreased Rakta Dhatu Nirmana severely affect the portion and nutrition of the Uttaratar Dhatu, and there is formation of there is no formation of normal Rakta Dhatu. There will be formation of Malarupa Rakta Dhatu, which is unable to carry out the physiological function. So pachana of such Malarupa Rakta Dhatu leads to formation of Ama, and there will be Tidusha Prakopa, which lead to the Bijodustrijanya Panduroga. So on the basis of contemporary knowledge and concepts of Ayurveda regarding the Bija Bhaga, Bija Bhaga and Bija Bhaga, we can have a Sampratti like this. So on the basis of these terms, which can be similar to the nearer term in genetics and terms for thalassemia, that Bija can be compared with sperm, ovum or zygote, and terms for thalassemia also sperm, ovum, zygote is involved. Bija Bhaga may be compared with the chromosomes, that in case of thalassemia, there is involvement of chromosome 16 and 11. And Bija Bhaga Avayava, that is can be compared with gene locus, promoter region, axons, interns, and there is in case of thalassemia, these are the alpha and beta cluster. Now coming to the Samprapti Ghataka, that there will be dosa, you know that already, it is a Pitta Pradhan Tedosa. All dhatus are already involved, but Rasa Rakta is firstly involved, and then that involved the Uttaratar dhatus. So all the dhatus involved which lead to the Nisara and Sithilendriya in the Pandu. And Agni already discussed that Dhattvagni Mandya, Raktagni and Rasagni Mandya is there, and that is Atragni Mandya. Rasava Raktabata Sattva Satas is mainly affected, but it affects all the Srutas. Satudushti is Sangha type, and Udhavasthana is Bija, then Amasva and Papasweta. Adhisthana is both Sarira and Mana, and Vyaktasthana is mainly in the Tocha, and this is the Bahya Roga. Now coming to the comparative symptoms which we found in Pandu, and there is in thalassemia the pallor which seen in the Tok Pandutva, and reduction in HB, the Raktalpata, chronic fatigue that is described as a Gatra Saga, weakness that is described as Durbalya, irregular fever that is Jwara is also there, anorexia that is Annodit, ectory changes to sclera that is Pitta Netrata, bronzing of the skin that is Tok Krishna Pandutva or Runavatva, puffiness of eye that is Okhikuta Sotha, muscle cramp that is Mudite Riva Gatrischa, they have described. And there will be consequent hepatomegaly and splenomegaly is there. Now, what should be the IVD drug intervention in thalassemia? That concept is given, Dr. Pandey has described already in detail. So I'll just simply touch all this because you know all the that there is a asadhya nature of genetic disease, but we can support the patient in other ways by having the Nidana Parivarjana, Pathyabhyasa and Rasayana drugs which protect from them other complications. It is the obvious thing that blood transfusion, which is the only available predictable medicine for the treatment of thalassemia, which can give an immediate relief to the patient. And the goal is to maintain the HP level between 10 to 12 gram per DL to ensure an active life interval, which was increased during the treatment period. The Ayurvedic medicine can be administered as an adjuvant and supportive therapy with existing management. That is the Rakta Sodhana Gana, Rakta Prasadana Gana, Sonita Sthapana, Varnya and Pandogana, Yakrut Pliagana drug may be responsible, and that may help in the to increase in the blood transfusion interval. You know that the iron overload is the main complication of thalassemia major, which result as a consequence of repeated blood transfusion. And due to repeated blood transfusion, there may be chance of infection of HIV and other infections. So due to this consequent repeated blood transfusion, there is excessive iron is deposited and that should be removed from the body. And this can be achieved, Ayurveda can help by prolonging the BT interval and by searching orally active iron chelators, which should be palatable, inexpensive and non-toxic. So there are so many drugs, herbals and also minerals mentioned in Rasastra suggested for Loha Savanajanya Vikara Prasavana, Loha Sodhana Gana, Loha Marana Gana and Loha Dravaka Gana, which can be used in iron chelators to decrease the iron overload due to the similarity of symptom between Asuddha Loha Savanajanya Vikara and the complication of thalassemia, that is iron overload. So in spite Besides these, some drugs mentioned in Ayurvedic classics in various diseases also can be used in the management of thalassemia. According to clinical manifestation, like drugs used for Panduroga Chikisa, Yakrit Vikara Chikisa, Pliha Vikara Chikisa, Rakta Sodhana, Sroto Sodhana, Lekhana, Vedana, Tridosahara, Rasayana, Boyasthapan, and Boiler drugs, which can be a great support to the thalassemic patients. These are the two drugs which I just shown about the research has been done. Musta Triphaladi Avalaya and Gandhaka Adi Yoga tablets. The combination that showed improvement in almost all the cardinal features as well as in the laboratory parameters. So in Ayurveda Prakash also there is Agastya Patra Sorasa Bhavita Vidanga Churna that has been mentioned in context to Loha Sabanajani Vikara Prasavana. That can be also be used. Extract of amalaki and ascorbic acid that can prevent the toxic effects of iron. Both drugs may have the chelating effect on iron. In that way, their consumption helps to regulate the metabolism of iron and avoids excess accumulation. Gandhaka is used as a Loha Marana Dravya and included in Loha Marana Gana. So you know that Marana is a process by which dhatus are altered in absorbable, assimilable, and adaptable form. It is a Asadhya Vyadhi that can be classified under Pratakya because it is not exactly Pratakya, it can be Japya, but there is a risk in the life of the patient, especially in case of thalassemia measure. Now coming to what are the new researches done, so which I have just searched the internet and I got some few papers which I quote here. That first one is that done by Atul Bhavsar, which has a dissertation, the PhD thesis in Tilak Ayurveda Vidyapit, that efficacy of Raktabasti in the management of Tidosa Panduroga, which special refers to thalassemia measure. They have included 30 patients of Tidosa Pandu having resemblance with thalassemia measure. The selected cases are having hemoglobin between 5 gram percent to 10 gram percent. That was selected for the trial group along with the control group of 30 patients which are taking the conventional treatment. And they have performed the Raktabasti with a goat blood, 250 ml along with Ayurvedic Rakta Skandavarodhaka on alternate day for 4 weeks. And allopathic treatment thalassemia was given in group B for 4 weeks. And they followed up the patient for 1 month. 1 month treatment and 1 month follow-up. Rakta Skandavarodhaka they prepared from the, it is Nimbus Swarasa along with the Purpata Kyara. They mentioned in the thesis. They have used so 250 ml goat blood, Rakta Skandavarodhaka drugs and alternative for 4 weeks. The result they have found that significant improvement was seen in symptoms like Panguta, Hridaya Darvalya, Darvalyata, Brahma, Sisiradvesa, Krishna Nakhatva, Krishna Netrutva, Swasa, and Sunakhi Kuta. And in the laboratory parameter, they have found that there is mean increase hemoglobin was 2.45 gram percent in group A in the treated group in comparison to 2.53 gram percent in the conventional blood transfusion along with iron chelators. So they have mentioned like this. So I think I found it is very useful. The principle that Raktahave Raktam Pivir, that it is not possible to drink the blood directly. So they have given the alternate method by given a drop by drop method through the anorectal pathway. So in overall patient that out of 30%, 80% improved markedly, 20% improved moderately, and only 2% showed mild improvement after 60 days of treatment. While in group B, no patients improved markedly, 17% improved moderately, and 13% showed mild improvement. Another 5 researches that has been done regarding the thalassemia and that management by Dhatri Avalaya, Triphaladi Avalaya, then again Triphaladi Avalaya, then again Triphaladi Avalaya. 3 theses has been done on Triphaladi Avalaya, and another was the last one is the Musta Triphaladi Avalaya. And the result is before you. They whatever they have, it is a published data in various journals. So I collected these data and to put before you that Singh R in her study reported that only 19% they have trialed in Dhatri available found provided insignificant result in all laboratory parameters, but significant result was found in BT interval in Dhatri available treated group in comparison to control group. So Dhatri available is very much significantly found to increase the interval of the blood transfusion. It is also a great achievement. Then Jadhav S in his study reported that they have treated 30 patients. Trifladi available provided significant result in all laboratory parameters except in total proteins. In the control group, all the laboratory parameters are unaffected. The control group they are unaffected, but in Trifladi available they provide insignificant result in laboratory except only there is improvement in total proteins. Then Patalia A in her study they have treated 32 patients in Trifladi available. They found that there is statistically highly significant decrease in SGOT level and significant decrease in SCPT, while statistically insignificant result in rest of the parameters. Again, in 41 cases, Rathoda reported that better percentage of relief in hemoglobin, serum TIBC, and serum ferritin level, but statistically highly significant result on rest of the parameters. But the effect of control group, control drug on SGOT, SGPT, serum bilirubin, TIBC are found statistically highly significant in comparison to the Ayurvedic drugs. Rajgolkar is in 42 cases, they have reported that Mustatrifladi available provided statistically significant increase in hemoglobin and serum TIBC, total iron binding capacity, while insignificant increase was found in SGOT, SGPT. Sorry, it decreased, not increase. Serum bilirubin and serum iron. But serum ferritin was decreased, which is statistically highly significant. So these are the few researches which I searched the internet and published. They have been published in various journals. So that can be used further trial and further study, which can be helpful to the thalassemia patients. In addition to these, the two research works have also been carried out in the IPGTRS Jamnagar on Gandhaka Adi Yoga and thalassemic iron overload, a comparative pharmaceutical clinical study of Gandhaka Adi Yoga in iron overloading condition due to Dr. Vikriti, and pharmaceutical standardization of Gandhaka Adi Yoga and effects on thalassemic iron overload with reference to Kadali as Patya. So they have done the standardization of pharmaceutical, pharmacological, toxicological studies of Gandhaka Adi Yoga that include Agastya and other drugs, and clinical observations of healthy volunteers are also done. Gandhaka Adi Yoga, they have been evaluated that iron sorbitol induced iron overload in albino rates by Pramod Jadhav et al. They have mentioned that this helps in the reducing the iron overload in the patients. So with this, I just take home message that there is no exact correlation to thalassemia measure with any type of pandu, but it can be, a new term can be coined with the term that Bijadushtijanya Panduroga, and this etiopathogenesis of disease can be interpreted by the application of methodology described by Acharya Charaka in Vimanasthana in context of Anukta Vyadhi, Bija Bhaga, and Bija Bhaga, the Dushti, and about the this Akhilya-Gatra Vibhaga concept. So thank you very much for giving me an opportunity to put forth my views. Thank you very much. Thank you.
Very nice, Doctor. Excellent. You have really highlighted along with the practical histories. Great. Respected Agnihotri ji, if you are coming, yes, please. Yes, please.
Namaskar, Dr. Sharma ji. Well, again, the second speaker is also coming from BHU IMS, and since he belongs to the Rognidan Vikrit Vigyan Vibhag, he paid more attention for the onset of the disease in terms of the Samprapti as far as the Ayurvedic part is concerned. While Professor Pandey ji already discussed a lot, so Dr. Kar is also mentioned all the types and the subtypes, but at the same time, 2 points he highlighted as I can say, the add-on situation. That is, he talked about the Atulya Gotra Vivaha. That is very true. If you go for the Sari Sthan, Thato Atulya Gotra Vyakhyasama. In that way, it is known that some diseases are always there, like the albinism, etc. So he also touched the area of Bij Bhag and Bij Bhaga. These things are definitely taken into consideration to decide that at what level the say vitiation occurs and which results in the form of the thalassemia in the progeny. So the fact is this, that these things are very important, but still we are having the cross fingers that to which extent we can be helpful of that. He also talked about the that as far as the symptoms are concerned, there will be dorvalya, there will be jwar and anorexia. These are the points which ultimately leads to the hepatomegaly and splenomegaly's onset on examination. So we can proceed with the line of treatment as far as the spleen disorders and liver disorders is concerned. So that's why the whole of the pathology, or the I can say the physiopathology, is to be taken under consideration. But one thing he pointed out very well, that nidanam parivarjanam, and when the nidan is say congenital, so that cannot be parivarjan. But based on the symptoms occurring day by day, some of the very good studies which he quoted in a form of the avleh, say dhatri avleh or trifla avleh or even bacha avleh, is very important. The next point he raised for the Raktavasti, it is also of great value. The moment he told that Raktavasti, one point is very spontaneously came in my mind, that how he will use the blood, of course coming from goat, that it always leads to coagulation. So he then added that Nimbusaurus or anticoagulants parts may also be used. So it's one of the rare approach, I think, because to manage goat blood itself is a problem, and then to be inserted in a form of pasti. But if at all it is performed, definitely not only the patient will be improved, but as he also talked about the support, the moral support of the patient is equally important. So he finished very well, and I think this is what the quality of the actual academicians. He is not only putting his views in this webinar, but also teaching the same way to our students. So very good, well done. And I think he will always keep his mind open for newer experimentations and results which will be benefited ultimately to our patient. Thank you.
Thank you, sir. Thank you, sir.
Thank you, doctor. Thank you very much. Thank you, Anukul Chandji. Excellent. Now session is open. I welcome Harish Verma from Toronto, Canada. Welcome, sir. If you have any suggestion, question or valuable remark, welcome.
सर जी प्रणाम, और सभी आचार्यों को प्रणाम। मैंने अभी ज्वाइन किया है, तो आज मैं यूट्यूब पे सुनूंगा, बट ये बड़ा इंपॉर्टेंट टॉपिक है। थैलेसीमिया का वर्ल्ड वाइड कोई ट्रीटमेंट नहीं है स्वाय ब्लड ट्रांसफ्यूजन के। पर इसमें मेरा एक क्वेश्चन है डॉक्टर अग्निहोत्री जी से कि मॉडर्न साइंस में आयरन को कॉन्ट्रा इंडिकेशन बताया गया है कि आयरन शुड नॉट बी गिवन टू थैलेसेमिक पेशेंट्स। तो धात्री में आयरन काफी होता है, कई लोग धात्री लो की बात करते हैं, तो उसको हम कैसे देखें? मैं एक
यस सर आपकी आवाज डिसकंटिन्यू हो गई। हेलो वर्मा जी,
प्लीज अनम्यूट योरसेल्फ हरीश जी।
जी सर, तो आयरन जो है ये कॉन्ट्रा इंडिकेटेड होता है थैलेसीमिया में। तो हमारे यहाँ आयरन की कुछ प्रेपरेशंस रिकमेंड करते हैं लोग, आयरन जैसे धात्री लो, इवन धात्री में काफी आयरन होता है आंवला में, तो उसको हम कैसे देखें? मतलब मॉडर्न साइंस में आयरन को कॉन्ट्रा इंडिकेशन बताया गया। मैंने पेपर भी एक इसमें रिसर्च पेपर है, मैंने चैट में डाला है, तो काइंडली इसके बारे में थोड़ा बताएं कि ये कैसे है कि हम आयुर्वेदा में आयरन प्रेपरेशन देते हैं, मॉडर्न साइंस में उन्होंने आयरन को कॉन्ट्राइंडिकेटेड बताया है फॉर द थैलेसेमिक पेशेंट्स। इसके बारे में थोड़ी सी क्लैरिफिकेशन दीजिए सर। धन्यवाद। नमस्कार सर।
सर आपका पॉइंट बहुत जस्टिफाइड है। और देखिए, मॉडर्न मेडिसिन वाले भी जब ब्लड ट्रांसफ्यूजन की बात करते हैं तो नेचुरली उसमें आयरन तो बनता है, वो टोटल डोज आयरन के हिसाब से नहीं देने की बात कर रहे हैं। और जो अभी डॉक्टर का बोल रहे थे अपने रिसर्च बेसिस पर, तो उन्होंने पाया कि सर्टेन ग्राम आयरन इंक्रीज करता है अगर हम हेमेटोनिक्स के तौर पर आयरन की आयुर्वेदिक प्रिपरेशन देते हैं। और उधर रक्त बस्ती की बात भी आई है। तो आइडिया क्या है, जो हम धाती लो वगैरह देते हैं, क्योंकि हम ये ओरल रूट से दे रहे हैं, तो इसको डाइजेशन, मेटाबॉलिज्म एंड देन एब्जॉर्प्शन एंड देन रीचिंग टू इट्स साइट ऑफ रिक्वायरमेंट, लाइक द ब्लड इज फ्लोइंग ब्लड इटसेल्फ। तो माइक्रो मिलीग्राम में आयरन पहुंचेगा। पहली चीज, अगर हम डायरेक्ट आयरन के नाम पर नवायस लॉ या पुनर्नवा मंडूर या धात्री लॉ के रूप में दें तो एकदम से एब्रप्टली तो नहीं बढ़ेगा। उनका कॉन्सेप्ट ये है, चूंकि वो ब्लड ट्रांसफ्यूजन देके देते हैं, इसलिए वो ओरल रूट से आयरन मना करते हैं। एक और चीज है, मॉडर्न मेडिसिन का आयरन जो है वो डायरियल टेंडेंसी को होता है, जबकि आयुर्वेदिक प्रिपरेशन आयरन की जो है वो कॉन्स्टिपेशन नेचर की होती है। तो उन दोनों एंगल से चूंकि आम त्रिफला में दे रहे हैं, तो न तो कॉन्स्टिपेशन होगा और एज पर द माइक्रो मिलीग्राम लेवल रिक्वायरमेंट जो है वो सप्लीमेंट होती रहेगी। बाकी स्टिल ये रिसर्च का विषय है। और मॉडर्न बेस्ड जो आपकी साइंटिफिक अप्रोच है, मतलब जिस ग्राउंड से आपने बताया, वो अपनी बिल्कुल जस्टिफाइड है। तो इट डिपेंड दैट विच क्वांटिटी। और वो ये ना कि पुरुषम वीक्ष वाली बात आ जाएगी कि कितनी मात्रा में किस लेवल के, किस एज के बच्चे को या किस एज के पेशेंट को हम किस डिवाइडेड डोज में दे पा रहे हैं। और वी आर सपोज टू कीप दिस पेशेंट अंडर ऑब्जर्वेशन सो दैट वी कैन सी any abrupt development or precipitation of the symptoms. So scientifically अगर हम मॉडर्न मेडिसिन के उस एंगल से जाते हैं, इसलिए वो मना करते हैं। वहां पर एब्रप्ट आयरन बढ़ने की बात आ सकती है, शायद ये एक पॉइंट हो सकता है। दिस इज माय ओपिनियन। बट जब हम ओरल रूट से दे रहे हैं, तो आई डू होप दैट आवर आयरन इज नॉट गिविंग एज अ नीट आयरन। We are giving iron with the fibers like Trifla or Dhatri. So in that way, it will not directly affect, I mean, in a negative form. This is my opinion. Thank you, sir.
थैंक यू सर, थैंक यू सर। इस विषय में मैं डॉक्टर अनुकूल चंद्र जी से, अनुकूल चंद्र जी कहाँ हैं? नहीं, डॉक्टर अनुकूल चंद्र जी नहीं है हमारे साथ, नहीं तो उनसे ही पूछते। वैद्यराजन पटनकर सर, वैद्यराजन पटनकर सर, स्वागतम। आप तक मेरी आवाज जा रही है?
वैद्यराजन पटनकर जी म्यूट हैं, प्लीज अनम्यूट करिए।
काइंडली अनम्यूट योरसेल्फ सर। विष्णु प्रसाद शर्मा जी का स्वागत है दोबारा। जगदीश्वर जी, आप कुछ बोलेंगे थैलेसीमिया पे? आदरणीय जगदीश्वर जी।
दादाजी नमस्कार, सभी लोगों का विनम्र प्रणाम। यहाँ पर अभी जो प्रश्न किए थे वर्मा जी ने, हरीश वर्मा जी ने, उसका एक माने एग्जाम्पल अपन ले सकते हैं। हर द्रव्य को अपन जब आयुर्वेदिक में डिस्कशन करते हैं तो उसका निज स्वरूप और विपाक स्थिति में उसका क्या प्रभाव। तो टेक फॉर ओनली ब्लैक पेपर, दैट इज मरीचा। मरीचा तीक्ष्ण रूक्ष्ण जो भी होने के बाद विपाक स्थिति में वो मधुर रस को उत्पत्ति करता है, अम्ल रस नहीं है। ताकि अभी मिर्च जो होता है ना, जिसे लंका बोलते हैं बंगाली में, तो वो तो अम्ल रस पैदा करता है। इसीलिए आयुर्वेदिक सिस्टम में अगर समझे कि आम्ला जो धात्री अभी डिस्कस कर रहे थे, उसको अगर दिया जाए तो वहां पर ये कॉन्ट्रा इंडिकेशन मैं नहीं समझता हूं, अकॉर्डिंग टू द इंटरप्रिटेशन ऑफ मॉडर्न मेडिसिन पीपल. And here I refer, especially I have seen two children whom born, two children, दोनों को दोनों ने फीमेल है, तो दोनों को दोनों थैलेसेमिया पेशेंट्स हैं. एक तो 7 years की, एक 5 years की. जब मैं देखा हूं तो वो दोनों को मैं ऐसे ही मिलते, फर्स्ट टाइम है वास्तव में मेरे यहाँ थैलेसेमिया पेशेंट्स कोई नहीं है. फर्स्ट आई हैव सीन दोस टू चिल्ड्रन. तो उसको मैं इतना ही बताया, वो कन्वर्टेड क्रिश्चियंस है, तो मैं इतना ही बताया कि आप लोग इनको जो है ना नॉर्मल जो फूड में इनको पोमेग्रेनेट माने अनार इंक्लूड कीजिए. जो अनार को इस्लाम में रेफर किया जाता है कि जन्नत की मेवा, उसको जो है ना कोई दोष नहीं है, कोई दोष नहीं है. तो इसीलिए हर प्रकृति वाला ने अनार ले सकते हैं. ये तो साथ साथ अनार का एक और गुण जो डायरेक्ट जो है ना हेमोग्लोबिन इंप्रूव करने का, हम अपन इसको कंपैरेटिव स्टडी करने के पहले जो है ना फ्रूट्स का जनरली जो है ना नेचुरल प्रोविजन होता है. तो उस सिलसिला में मैं उनको इतना ही बोला, यू कंटिन्यू गिविंग पोमेग्रेनेट. इमीडिएटली the father reacted to my statement and said that the doctor has forbidden to take pomegranate because he was allopathic doctor. He didn't know about the efficacy of the ingredients. Only they know the pharmacology. They do not know all these things which are being taken. Likely, there might be reaction from modern medicine side, but we need not give much attention to that. Let us have a trial of those things which the modern medicine states. In so many occasions, we have actually crossed over those statements, and we could find more efficacy in Ayurvedic system. Likely, what here we are also discussing, in another prescription, it was there that Punarnava Mandur and Swarnamakshika. These two are also are not in crude form. We are giving in Bhasma form. Then Bhasma it itself is such a process where the minutization will be there and there will not be much contraindication. If there is contraindication also, that can be provided. For example, to improve the hemoglobin, there is a combination in Vaidya Yoga Ratnavali given by, written by, I'm forgetting his name immediately, it is not coming, with Sitopaladi churn 50 grams and Abraka Basma 2.5 grams and Swarnamakshika Basma 2.5 grams and 1.5 gram Kantaloha Basma and 10 grams of Guduchi Sattva. These mixed together, given at the dose of 3 grams, 2.5 and 3 grams, it improves hemoglobin very nicely. Either it can be taken in Sitopaladi Churna or it can be taken with Talisadi Churna. Likely, it is the combination. If we tax our brain to Kantaloha only, then we will be in confusion. In what way it works in the combination, then we can make a trial of it. Why should we get worried of one therapy statement? Likely, where there is mentioned such contraindications, such references, we need not get worried what my thinking goes on. Thank you very much.
I would like to go with the Dr. Doma's stand. Thank you, sir. Thank you. You not only defended me, but also made very clear when it became in a form of Bhasma, it finally divided. So it will work slowly, step by step, and not in a reaction form as the modern medicine iron can do. That's why they contraindicate it, and they are really based completely, their knowledge is based on the pharmacology. Thank you, sir. Very, very clear.
अग्निहोत्री जी,
डॉक्टर
अग्निहोत्री जी,
जी
एक मिनट के लिए यहाँ पर अपने यहाँ क्यों ऐसा नहीं जगती है इंटेलिजेंस का कि भस्म प्रकरण कब उपयोग कर सकते हैं, रस रसायन प्रकरण कहाँ उपयोग कर सकते हैं, अवलेह कहाँ उपयोग कर सकते हैं, चूर्ण किस अवस्था में उपयोग कर सकते हैं, आसवारिष्ट किस स्थिति में उपयोग कर सकते हैं, वटी गुटी किस स्थिति में उपयोग, ये सब तो भिन्न भिन्न रूप में और भिन्न भिन्न स्थिति में वास्तव में अगर देखा जाए भस्म प्रकरण बहुत ज्यादा जो है ना चिल्ड्रन में उपयोग करने का, और जो दुर्बल स्थिति में क्यों भस्म प्रकरण दिया गया है, आयुर्वेदिक शास्त्र में भस्म प्रकरण क्यों दिया गया, रस रसायन अलग किया गया, वटी गुटी का अलग किया गया, चूर्ण का अलग किया, अवलेह, असवारिष्ट, कषाय, ये सब किस लिए दिया गया है? इट्स ए वास्ट सब्जेक्ट, a limited subject of modern medicine should not be interpreted with Ayurveda. Ayurveda it itself is Ayurveda. It is a Veda, that is knowledge. It is a limited science of materiality. And this materiality cannot influence the spiritual oriented science of medicine. What I say, spiritual oriented medicine, science of medicine. It should not be influenced. Go for the trial. Now we are coming in a generation of making a trials of that and this. In good olden days, was it surviving in India? In Bharat? No, nothing. The Vaidyas, how they were serving and how they were administering, though they were not well versed with the voluminous books and its pages and the contents of the voluminous books, but they were successful because with just a twist of अनुपाना, वो लोग एक दवा को लेकर के अनुपान जो देते इतना उपयोग करते थे भिन्न भिन्न रूप में, चाहे वो वात विध्वंस क्यों ना हो, चाहे आनंद भैरवी क्यों ना हो, और कोई क्यों ना हो, रहने का कुछ ही दवाएं, लेकिन अनुपान भेद से जो है वो लोग बहुत से व्याधियों को चिकित्सा करते थे। वो हिम्मत अभी नहीं है, और वो जो है ना अनुपान भेद से करने का चिकित्सा सीखे बहुत अच्छा होगा, लेकिन जो कॉम्बिनेशन अभी जो देते हैं वो तो काफी अपन डिस्कस करें, अभी मैं बताया इसमें तो अपने को आसानी से मालूम पड़ता है, ये भस्म आसानी से अब्सॉर्ब होता है। धन्यवाद।
Thank you, sir. Thank you. Actually, sir, we are here not to criticize anybody's pathy, but this is fact that they are not knowing the whole procedure of making bhasmas by our Ayurvedic text. That's why they outright contradicate that how you can do like this. They are free to contradicate or stop not giving iron according to their pathy. But the procedure of making bhasma is so critical and so deep that it transfers the so many bhavna devas value to the prepared form of the bhasma. That's why it contains a lot of plus points. Along with the role of anupan, it exaggerates or it also increases the say not only the efficacy of the given medicine, but also makes the our preparation or our approach safe. That's why the anupan and sapan are of great value. So it is true that either they learn that what Ayurvedic methodology for the preparation of so many, may it be bati, gutika, bhasma, churn, etc., etc. We are confident enough to proceed with. And our 3-4 up generations were doing a lot. They were preparing their own preparations and confidently, freely using these medicines to the patients, irrespective of any doubt. Now the era of documentation, research-based things are of great value in the modern or in universal society. That's why they can just put that it should not be given like that. But we are very clear, and as per your vision, as per your insights, the things are very clear, and we need always such type of intelligence and knowledge-oriented persons. Thank you, sir. Thank you.
जी डॉक्टर पवन जी 1 मिनट चाहिए मुझे।
प्यार से सर, आपका है, मेरे को कभी काइंडली ऐसा परमिशन मत मांगा कीजिए, आपका ये
तो मुझे थोड़ा जल्दी भी है आज, क्योंकि यहाँ डे टाइम होता है तो बार बार क्लिनिक से कॉल आ रहे हैं। तो मैं ये बताना चाहता हूँ कि मॉडर्न मेडिसिन में एंटी आयरन ट्रीटमेंट दिया जाता है, किलेशन थेरेपी दी जाती है। हम लोग आयरन दे रहे हैं, वो आयरन को निकालते हैं। आप पढ़िए, मैंने आर्टिकल पोस्ट किया है, तो इसके बारे में गंभीर चर्चा की जरूरत है। तो इसके बारे में अगली बार मैं जरूर इसमें पार्टिसिपेट करूंगा। आयरन तो बिल्कुल नहीं दिया जाता किसी भी फॉर्म में। जो हमारा क्लेम है कि भस्म है, ये भस्म ठीक है, भस्म को हम मेटल को उस लेवल तक ले आते हैं कि जिसमें वो इजिली एब्जॉर्ब हो जाए, लेकिन आयरन तो एंड तक आयरन ही रहेगा। तो आयरन का मेटाबॉलिज्म सारा आप आर्टिकल पढ़े, ये जो मैंने पोस्ट किया है, इसमें एंटी आयरन ट्रीटमेंट दिया जाता है, किलेशन थेरेपी दी जाती है। तो ये कैसे पॉसिबल है कि हम आयरन से थैलेसीमिया को ठीक कर पाए? तो इसके बारे में और विचार करेंगे। आज मैं थोड़ा जल्दी में हूँ, क्षमा चाहता हूँ। धन्यवाद।
पटनकर साहब कुछ बोलेंगे? आदरणीय पटनकर जी, वैद्य राजन पटनकर साहेब, काइंडली अनम्यूट सर।
साहब वगैरह मत बोलो, हाँ मैं भी आप ही के जैसा हूँ। तो बहुत सारी बातें सुनी, थोड़ा थोड़ा बीच में पेशेंट देख रहा था इसके लिए नहीं सुन पाया, पर जैसा अभी भी हरीश जी ने कहा कि भस्म के बारे में और भी अच्छा डॉक्यूमेंटेशन और रिसर्च होना जरूरी है। मेरा जो अनुभव है कि अगर सिर्फ हीमोग्लोबिन की बात की जाए, मतलब बाकी जैसा है कि हर एक धातु का अग्नि बढ़ना चाहिए, ये सब बातें अच्छी है और वो करनी भी चाहिए, पर जो अपना जीरक है, जीरा, उसका बहुत अच्छा फायदा होता है, ऐसा मैंने देखा है हीमोग्लोबिन बढ़ाने के लिए। और उसी के साथ में कि जो थोड़ा सा निग्लेक्टेड अवलेह जो है कि कुष्मांड अवलेह, उसके भी बेनिफिट्स बहुत ही अच्छे हैं। स्पेशली कि जिसमें हेमोप्टिसिस होता है, ऐसे पेशेंट कि जो बहुत सालों तक अलग अलग ट्रीटमेंट लेते हैं और जिनका हीमोग्लोबिन लेवल भी कम रहता है और उनका जो अग्नि है, जो पाचक अग्नि, वो भी एकदम कम हो जाता है, तो उसमें सिर्फ कुष्मांड अवलेह भी बहुत अच्छा काम करता है। ये मेरा अनुभव है। आज का जो सब्जेक्ट था वो बहुत ही अच्छा था, सब प्रेजेंटेशन भी बहुत अच्छे थे, सो थैंक यू वेरी मच। और जगदीश्वर जी ने भी बहुत ही अच्छे पॉइंट्स रेज किए कि भस्म के बारे में, कि हम लोग अगर अच्छे भस्म अगर यूज करेंगे कि जो प्रॉपरली प्रिपेयर्ड है, तो उसके बेनिफिट्स भी बहुत अच्छे हैं। तो इसके लिए उसके बारे में जो क्वेश्चन मार्क है वो निकालने के लिए मैं हर एक भस्म का भी सूक्ष्मीकरण करता हूँ, तो इसके लिए और भी सेफ हो जाता है। थैंक यू वेरी मच पवन जी, थैंक यू वेरी मच।
ये कई रेफरेंसेस हरीश जी के लिए मैंने इंटरनेट पे ऐसे ही टाइप किया था, तो कई रिसर्च पेपर हुए हैं जिसमें लॉ ऑफ भस्म डायरेक्ट दी है, फिर भी कहीं कहीं मंडूर भस्म को प्रिफर्ड ओवर लॉ ऑफ भस्म बताया है। तो ये थैलेसीमिया की ट्रायल हुई है साहब, धात्री लॉ की भी हुई है, लॉ ऑफ भस्म की भी हुई है, मंडूर भस्म की भी हुई है।
यस
ये हुई है सर, ये कंट्रोवर्शियल पॉइंट्स हैं। डेफिनेटली हम लोग डिसाइड करेंगे धीरे धीरे।
जरूर 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 जरूर।
थैंक यू सर, थैंक यू।
पवन जी एक मिनट मुझे अनुमति देंगे?
अरे आप मालिक हो आप।
इसमें एक और चीज भी देखिए कि लोह भस्म उष्णवीर्य माना जाता है, लेकिन मंडूर भस्म उष्णवीर्य नहीं माना जाता, उष्णवीर्य नहीं माना जाता मंडूर भस्म। और इसीलिए अपन जो है ना, प्रकृति के अनुसार जहां लोह भस्म दे सकते हैं वहां लोह भस्म दे सकते हैं, जहां मंडूर भस्म दे सकते हैं वहां मंडूर भस्म, और साथ साथ स्वर्णमाक्षिक कहाँ देना, ये तो बहुत से विभिन्न रीति में है। तो इसीलिए हर अपने यहाँ द्रव्य जो प्रकृति से दिया हुआ, अपने ऋषि गण ने इतना विस्तार रूप से उसका ये भी बताए कि ये किस प्रकृति वालों के लिए सुटेबल है। हम ये नहीं बोलते हैं जहां विपरीत स्थिति में हम देंगे तो कैसा होगा, उष्ण प्रकृति, उष्ण पित्त प्रकृति में हम डायरेक्ट लोहा देंगे, उसमें लोहा में भी लोहा, कांत लोह का गुण अलग होता है और लोह का गुण अलग होता है। कांत लोह का क्यों अलग? इसमें डिटेल स्टडी इतना विस्तार से ocean of subject which is not being even taken into consideration, only the influence of modern system. This I hesitate to. When we are living in a house of a systematic expressions, and why should we be hazy of others dragging outside? We need not be dragged. That's why I distinguishedly put forth my subject and my presentation in this way. You thoroughly think about your house and your subject. Why do you get influenced by other subjects? You can have comparative study, but you are with abundant of wealth and searching for a charity. This becomes a I think that not Janayan, in Janayan. Thank you very much.
Agnihotri sir, कुछ concluding remarks. Thank you.
Thank you, Pawan Sharma ji. Namaskar.
शुभदीप सामंत कुछ बोलेंगे? मिस्टर शुभदीप सामंत.
सेशन तो बहुत अच्छा लगा, जो भी इंफॉर्मेशन था उसमें बहुत कुछ आज पता चला, मंडूर भस्म के बारे में और लोह भस्म के डिफरेंस के बारे में पता चला, और बहुत सारे अलग अलग चीज़ों के बारे में पता चला जो पता नहीं था। बहुत अच्छा लगा सुन करके। ऐसे ही आगे सेशंस अटेंड करता जाऊंगा और इंफॉर्मेशन लेता जाऊंगा। थैंक यू सर सो मच।
थैंक यू, ऑल द बेस्ट शुभदीप, एक्सीलेंट। अग्निहोत्री सर।
Thank you, Pawan Sharma ji. Namaskar. We are celebrating today 371th webinar in a continuation. So it's a great day, and every day is a great day. Our presenters, guest speakers were really enriched with their knowledge, and that knowledge has been well projected to our webinar. Both the persons coming from BHU and both were of very high level clinical and academic experienced person. So before commenting upon them, first of all, as our tradition, we extend our regards to all the greatest our dignitaries in of today's webinar's presence, though it was a poor presence. Professor BP Sharma Sahab, Dr. Pawan Sharma sir, Professor Kuldeep Pandey ji, Dr. Harish Sharma ji, Dr. Doma ji, and Dr. Rajan Pratankar ji. I think in the continuation of the presenters, guest speakers, whole presentation, I think we have gone to very deep discussion, and this is the pleasure and the result of our webinar. The fact is this, that all the persons are coming from our Ayurvedic section. So very naturally, very confidently, it's our pleasure that all are of same view. It's good. And even being Harish Sharma ji, he's a gold medalist and he's also coming from Ayurvedic section. He is scared simply on that point that modern medicine persons are restricting the input of iron. Otherwise, as an Ayurvedic background, he is always using good medicines, and I think Sonamakshi is one of them. But our two gentlemen, with all their knowledge, put forward a few things that is very important, and that cannot be put with any question mark, like Jirak, Anar, Pushwand, Kali Mirch, Kantlo. These are a few things. Even if I just delete the Kantlo, the rest of the items are of great value, not directly having the higher concentration of iron. Jirak is always there for Deepan Pachan. So धात्वाग्नि के रोल को बढ़ाने के लिए, खाए गए भोजन को सही से पचाने के लिए जीरा बेस्ट है। हम हमेशा पढ़ते चले आए हैं, प्यूविनम साइनम इज अ ग्रेट थिंग, और उसको हम लोग हमेशा पाचन के लिए लेते, कोई बात हो। और इसमें जल जीरा, तरह तरह की जीरा, इवन हाजमोला, अपनी ये हरिचकी का, इनमें सब में जीरा के चूर्ण का पाउडर बनाते रहते दीपन पाचन तौर पर। और ऐसे ही अनार है, अनार में एक तो ये भी बहुत ही हृदय माना गया है, स्वादिष्ट बनाया गया दाढ़ी मास्टर चूर्ण, इसको हमेशा यूज करते हैं और बच्चे तो बहुत ही चाव से लेते हैं, बल्कि कहा जाता है इसकी डिब्बी को ऊंचाई पर रखिए, बच्चे ओवरडोज ना ले लें, क्योंकि इट इज सो टेस्टी। मोरओवर इससे मिश्री होती है तो वो मॉइस्चर जल्दी पकड़ता है, इसीलिए थोड़ा एयर टाइट रखने वाली बात आती है। कुष्मांड देखिए, कुष्मांड अपने में शीतवीर्य है और उसके लिए इसमें जो धातु पोषक का भाव है, इन जनरल जो दौर्बल्य है, जो आलस्य है, इन सबको दूर करेगा। शीतवीर्यता के नाते जो अगर कहीं ज्वर की व्यवस्था आती है उसको भी दूर करेगा। और यही चीज काली मिर्च की हमारे डोवा साहब ने और अच्छे से बढ़ा दी। तो ये कुछ चीजें हैं जो हमारी अप्रोच जो है होलिस्टिक अप्रोच है, हमारी अप्रोच आयरन टू आयरन नहीं है। और हमें जब उसकी मॉर्फोलॉजी, जो आरबीसी की मॉर्फोलॉजी में दिक्कत आ रही है, तो दो चीजें बिल्कुल जो छूट रही हैं हमारे प्रेजेंटर्स के अलावा, वो आती है अपने प्राणायाम का रोल। आप देखिए ना, भस्त्रिका इसमें बहुत बड़ा काम करने जा रही है, नो आयरन, बट बाय गिविंग impetus from outside to the body as a whole, it will incorporate the areas of body and mind both. So भस्त्रिका along with अनुलोम विलोम, मैं समझता हूँ सारी फार्माकोलॉजी अलग हो जाएगी अगर हम इस चीज तो हमें कोई दिक्कत नहीं। ठीक है, बच्चे छोटे नहीं कर पाएंगे, जितना करें उनको सिखा के। आजकल तो 4 साल का 5 साल बच्चा भी अब योग क्लासेस में जाने लगा, अच्छे से आता है। तो ये दो चीजें मेरे दिमाग में एकदम स्ट्राइक करें। अगर हम इस कंफ्यूजन से दूर रहना चाहें तो भस्त्रिका और अनुलोम विलोम को तो ठाठ से करेंगे, कोई दिक्कत नहीं। ठीक है, बाकी हमारे प्रोफेसर पांडे जी ने एकेडमिकली बहुत ही डिस्क्रिप्टिवली पूरा डिटेल बताया, सारी टाइप्स बताई, उसकी सिम्टोमेटोलॉजी बताई, और उसको उन्होंने हमारे आयुर्वेद से क्या कुछ संप्राप्ति हो सकती है और वहां पर कहाँ पर दिक्कत आ रही है वो बतला दिया कि हम धात्वाग्नि को इंटैक्ट रखें, हम केदारी कुल्य न्याय के हिसाब से भी चलें, तो उत्तरोत्तर धातु निर्माण के लिए प्रत्येक धातु की जो सुरक्षा और इंटैक्टनेस है वो उतनी ही जरूरी है। और धात्वाग्नियों के प्रबल करने के लिए ये बहुत स्वाभाविक सी बात है, हम अपने दीपन पाचन गण की औषधियों को बनाएं। हेमेटोनिक्स की बात तो बाद में आएगी, और एक्सक्लूसिवली अगर हम चलें कि हम चीजें तो बढ़ाएंगे, उसमें आयरन बिल्कुल नहीं होगा ऐसा नहीं है। हम लोग पता है ना, होलिस्टिक वाले लोग हम लोग हैं, तो आयुर्वेद के सभी विशेषज्ञ हैं, सभी विद्वान हैं, और किसी को इसमें कंट्रोवर्सी नहीं है। अब समस्या आती है हम कितने दिनों तक और कितनी दूर तक हमेशा मॉडर्न मेडिसिन की क्रिटिसिज्म को ही झेलते रहेंगे और उसके पीछे भागे रहेंगे अप टू द डॉक्यूमेंटेशन एंड प्रेजेंटेशन। अगर हमें अपनी बात मॉडर्न मेडिसिन वालों से मनवानी है तब तो हमें उनकी टर्मिनोलॉजी में कहें। मैं बीएचयू में कई बार ये कहता था, वी आर नॉट बाउंड टू ट्रांसलेट द बात इन देयर अंडरस्टैंडेबल वर्ड्स एंड टर्मिनोलॉजी। हमारी स्टैब्लिश्ड विज्ञान है, जैसे डोमा साहब कहते हैं, ये वेद की विज्ञान ने दिव्य चक्षु से इसको ग्रहण किया गया था। इसके रिजल्ट्स थैलेसीमिया नाम की शब्द ही नहीं था, तभी भी हम लोग मानव की चिकित्सा करते रहे हैं। तो हमारे कार साहब ने भी जो प्रेजेंटेशन दिया, उन्होंने भी अपना एकेडमी बेस अलॉन्ग विद द रोग निदान और विकृत विज्ञान के भाव से कहा। और जितनी संभावित चीजें, हमारे भाव क्या है कि हम बॉडी इन टोटलिटी को इंटैक्ट रखें। उन्होंने आश्वासन की भी बात की, हम पेशेंट और पेशेंट के अटेंडेंस को भी मॉरली सपोर्ट करें कि देखिए हम बहुत अच्छी चीजें दे रहे हैं, ये सर्वथा शरीर के लिए स्वास्थ्यकर है, इनको आसानी से डिवाइडेड डोज में लिया जा सकता है। और डोमा साहब ने बहुत ही अच्छा कॉम्बिनेशन बताया जिसमें उन्होंने वर्क भी किया 5 साल और 7 साल वाले बच्चों पर, जिसमें कि शीतोपलादी इन्होंने बतलाया, और उन्होंने ये स्वर्ण माक्षिक बताई, अभ्रग्रस्त बताया, लौह भस्म या कांत लौह भस्म की बात करी। तो ये कॉम्बिनेशन अगर देखें तो इन द लॉन्ग रन ये निश्चित रूप से पेशेंट की फेवर में रहेगा। हम कोई सिकल सेल एनीमिया या एनीमिया ऑफ एनी एटियोलॉजी पर वर्क करें तो भी ये काम करेगा। रही बात ये, हमें तो ऑक्सीजन का कंजुगेशन चाहिए, जैसा कि उन्होंने कहा था कि पित्तो अंबर पीयूषम, तो अंबर पीयूष तो में ऑक्सीजन हम लें, उसके लिए प्राणायाम भस्त्रिका हो गई, और साथ में हम वो शरीर को विभूषित कर दें जिससे कि जो भी पेशेंट ऑक्सीजन ले पा रहा है उसका सही ढंग से कंजुगेशन हो सके, जो कि हमारे ब्लड के द्वारा, आरबीसी के द्वारा पूरी बॉडी में सप्लाई होता है, ट्रेवल करता है, और लंग्स और हार्ट को भी सपोर्ट करेगा। अनार तो हृदय है ही है, दीपन पाचन काम हो गया। तो मैं समझता हूँ थैलेसीमिया को दिमाग में रखते हुए पेशेंट के अपलिफ्टमेंट के लिए इन टोटलिटी क्या कुछ किया जा सकता है, शायद ये वेबिनार का आज का आउटपुट बनेगा। और हेल्दी डिस्कशन बहुत अच्छा है, हमें अपनी ही प्रिपरेशंस की और गहराई से इसकी रोगाधिकार और अनुपान सहपान का सामंजस्य स्थापित करते हुए मात्रावत रोगी के बलाबल के अनुसार अगर हम देते हैं, तो मैं नहीं समझता हूँ मुझे मॉडर्न मेडिसिन वालों के किसी भी प्रकार से क्रिटिसिज्म का पात्र बनना पड़ेगा। और अगर बनना पड़ता भी है तो हम फॉर द ग्रेटर कॉज ऑफ द सफरिंग ह्यूमैनिटी हमेशा आगे रहेंगे, और तभी मेरा आयुर्वेद जिंदा रह पाएगा। आयुर्वेद को और अच्छे से और गहरे से इसके मेटलर्जी को, इसकी फार्माकोलॉजी को, इसके फार्माकोपिया को समझने का आज की तारीख में और अधिक आवश्यकता बन गई, क्योंकि अब हम विश्व के द्वारा जाने जाने लगे हैं, तो हमारा कर्तव्य और बन जाता है। हमारे यही आज के अपने कंक्लूडिंग रिमार्क्स हैं। थैंक यू ऑल। आप लोगों ने बहुत बड़ा सहयोग दिया आज आयुर्वेद के सच्चे अर्थों में आयुर्वेद को समझाने के लिए, और हमारे वैद्य राजेंद्र टंकर जी तो इस विषय में इतने गहरे से काम कर रहे हैं। लोग तो कितना क्रिटिसाइज करते हैं कि कहीं सूक्ष्म औषधि भी हो सकती है, लेकिन आपने सूक्ष्म औषधि के आकाश में वो चमचमाते हुए सितारे बन के उभरे हैं कि मैं सोचता हूँ आयुर्वेद आपके और प्रकाशमान होता रहेगा। और डोमा जी की जो एनालॉजी है, जो बहुत बड़ा एक प्रत्युत्तर है ऐसे किसी भी उद्भाव के लिए, हम एग्जैजरेट नहीं कर रहे, हम प्रत्युत्तर की बात भी नहीं करते, हम जो है वो ये है और हम सही है, हमें ये मान के चलना होगा। दैट्स थैंक यू सो मच। हमारे सारे आज के स्पीकर्स को बहुत बहुत बधाई, बहुत ग्रीटिंग्स, और हमारे सभी पिलर्स जो कि आयुर्वेद के लिए अपना तन मन धन से समय देके जुटे हुए हैं, उन सबको बहुत बहुत हमारा साधुवाद, बहुत बहुत शुक्रिया।
बहुत बहुत धन्यवाद सर, बहुत बहुत धन्यवाद। आज का बहुत ही चर्चा अच्छी रही, और फिर भी मैंने देखा इंटरनेट में सर्च करके कि हमारे लौ भस्म, धात्री लौ, मंडूर भस्म, ये सब पे रिसर्च हो चुकी है थैलेसीमिया में, तो कहीं हमको समझाने की जरूरत है, इसके अलावा कुछ नहीं। थैंक यू वेरी मच सर। अब हम परसों मिलेंगे, और अभी भी मेरा पटनकर साहब से और अग्निहोत्री साहब से आग्रह है कि मुझे 12 तारीख के लिए नर्सिंग डे है, नर्सिंग डे के लिए 2 अच्छी सीनियर रिटायर्ड नर्सेज चाहिए। उपचारज्ञता अक्षम वाली बात है, तो डेफिनेटली अब आप लोग सपोर्ट करेंगे, नहीं तो वो एक वैक्यूम हो जाएगा। तो 2 नर्सेस जो आयुष की नर्सिंग में हमें बता सकें, यदि शुभदीप जी भी जानते हो तो हमें आपत्ति नहीं है, जगदीश्वर जी से भी आग्रह है, लेकिन नर्सिंग इन आयुष,
आयुष वाली बात आपने जोड़ दी, आपने ये कंडीशन लगा दी, नहीं तो हमारे पटंगर साहब तो बहुत योग्य हैं। ये हमारी जो मुंबई की जो मेयर हैं वो नर्स ही है, हम समझते में याद आ रहा है। अगर उनसे अगर उनका कहीं आयुर्वेद की तरफ झुकाव हो सकता है कि हमारे बड़े बड़े वैद्य लोग चीफ मिनिस्टर हो चुके हैं, हमारे रमन साहब जो है चीफ मिनिस्टर रह चुके हैं, हमारे लक्ष्मीकांत वाजपेयी जी जो है वो मिनिस्टर रह चुके हैं आयुर्वेद के।
गोवा में सब बीएमएससी अपने चीफ मिनिस्टर हैं।
जी, गोवा के हमारे चीफ मिनिस्टर है। तो अगर किसी तरीके से उनसे जोड़ लिया जाए तो वो आयुर्वेद के वर्किंग नर्सिंग या रिटायर्ड नर्सेज को जोड़ लेंगे। मेरे पास एक कमलेश छेत्री जी का नाम याद आ रहा है, वो मैटर्न होकर रिटायर हुई हैं। अगर वो वेबिनार से जुड़ने का रखती हैं,
स्वागतम। एक 2 भी स्पीकर होंगे तो एक नई परंपरा चालू होगी। नर्सेज आर रियली इग्नोर्ड इन आवर आयुष
जी। और हमारे बच्चे जिन्होंने पढ़ाया, जो बच्चे तो छोटे अभी जो पढ़ाया सर्विस में आ गए हैं, हमारे यहाँ आयुर्वेद में नर्सिंग का कोर्स था ना, तो उसको हम देखते हैं। लेकिन हम अभी कमलेश जी से बात करते हैं, ठीक है।
धन्यवाद, बहुत बहुत धन्यवाद, बहुत धन्यवाद, आप सभी का बहुत बहुत धन्यवाद।
आज बहुत समय से हम लोग समय से फारिग हो गए, इसलिए पवन जी का बहुत बहुत धन्यवाद। और मतलब मुझे चिंता है कि आज भी हमारे सौरभ पुरवार जुड़ के भी नहीं जुड़ पाए, पता नहीं कैसा
है सर। जो आ गया सो अपना है, नहीं आया सो सपना है।
नहीं वो आएंगे, कभी आएंगे।